Hello and welcome to Take Your Medicine with me, Devin Hoodley. On today's show, we're going to be discussing dosage forms. Dosage forms contain an active ingredient, which is normally the drug, and also an inactive ingredient, which is also known as excipients. This combination of the active and excipients in a specific configuration to do a specific job in the body is known as a pharmaceutical drug dosage form. Simply put, a dosage form is a vehicle to transport a drug to a specific part of the body. For the purpose of today's show, I'm going to discuss the most commonly used and seen dosage forms in retail and community pharmacy. Firstly, we're going to be looking at ophthalmic preparations. So an ophthalmic preparation is a preparation that is used in the eye. Examples of this are eye drops, eye ointments, eye washes, and some eye emulsions. Ophthalmic preparations are used for antibiotics, which are normally used to kill off infections that are affecting the eye. They also use as antihistamines, which are common to treat irritation and allergies in the eye. Also, they have certain ones with anti-inflammatory properties, which are used to treat pain in the eye. The next type of dosage form we will be discussing is inhalation dosage forms. These include nebulizers, inhalers, vaporizers, and aerosols. The uses of inhalation preparation dosage forms are normally for treating conditions such as asthma, emphysema, chronic obstructive pulmonary disease. The next type of dosage form we'll be looking at is the parenteral or injectable dosage forms. The four most common types that we see are the intradermal, which is commonly used for the female contraceptive hormone. It is normally placed under the skin and can normally last a few months. The next type is the subcutaneous injection. These are commonly used for injecting insulin, example for diabetic patients. Intramuscular injections, and these are used to inject pain medications such as diclofenac for injuries. The last type of dosage form for the injectable type we'll be talking about is the intravenous or IV dosage form, and that's the one that you insert into the vein and commonly seen in hospitals and the clinic type of setups. These are to administer drug immediately and for emergency use. The next type of dosage form we'll be talking about will be topical dosage forms, and topical dosage forms are dosage forms that we apply onto our skin and any of our body surfaces as well. So those fall under creams, gels, ointments, powders. Other examples of topical dosage forms are your eye drops, your ear drops, and transdermal patches, such as your pain patches that you might have that you can apply onto your skin. The next type of dosage form I'll be talking about is the suppository. There are different types of suppositories and they have different types of uses. The most common type of suppositories we see in retail pharmacy is the suppository for vaginal use, which is most commonly an antibiotic or an antifungal suppository that is inserted into the vagina. And the other form of a suppository is the rectal suppository, and these are used in adults and kids and infants as well. These types are used for pain, nausea, constipation. The final type of dosage form that I'll be talking about, and the most widely used that I do see in pharmacy, especially in the retail sector, is the oral dosage form. And they come in different types, such as tablets and capsules, syrups and solutions, especially used in pediatric dosage forms and preparations. We also get powders and crystals, and also we have buccal preparation foams that we can apply into the cheek that contain medication. Also we have sublingual tablets where you place them under the tongue and they dissolve in the mouth and they absorbed through the oral mucosa and that enters the bloodstream. Another type is paste that we apply into our teeth. Everybody knows toothpaste. I'm just going to spend a few minutes on discussing the differences in the types of tablets, especially since that's the most common type that everybody is accustomed to and sees in their daily lives as well, and that we see in the pharmacy as well. So tablets are solid unit dosage forms. They are normally made up of a drug which is then pressed into the shape of a tablet, together mixed with excipients, which is your non-active ingredients. We also have caplets, which are tablets but they're shaped in a capsule shape. We also have oral disintegrating tablets. The most commonly type of disintegrating tablets are the sublingual tablets, which are placed under the tongue, and we normally see this in patients suffering with angina, and also sometimes used in patients with extreme anxiety. Sometimes you may notice that your tablets have an XR at the end of their name. This normally denotes an extended release tablets. What this means is these tablets are normally biphasic or triphasic, meaning they contain 2 different layers or 3 different layers of composition. And what this means is that the drug will release slowly over a period of time into your bloodstream. It normally lasts longer in your body, whereas compared to a normal tablet, which will normally be, as soon as it enters your stomach, will disintegrate quickly and then goes in through the stomach, gets absorbed by the liver and then pushed into the bloodstream quickly, and then the effects don't last as long as it would with the extended release tablet. It's important to note that these tablets are not meant to be broken, as then you would lose the effectiveness of the extended release. Also, you might also notice some of the tablets have a SR, slow release, and it works quite similar to your XR tablets. So XR, SR, those tablets meaning slow release. So please don't break those tablets up, as you will lose the potency and effectiveness of what its intended use is. The last thing that we'll talk about is capsules. And your capsules are normally gelatin shaped shell like objects, and they normally are a vehicle, as we said before, to carry a drug. So capsules can have different types of fillings, and you normally can have a powder filling of the drug, or some of them do come in an oily or jelly formulation, such as your omega-3s and your certain vitamins that do come in a gel form. Also with the capsule, please do not cut or break them, as you would then lose the intended use of the drug and you'll not get the full effect of the medication that you would be taking. So please guys, if you enjoyed today's show and you found it informative, please hit the like button and please subscribe, and please hit the notification bell so you'll be alerted to any other of our upcoming episodes. So guys, I hope I didn't bore you too much today with I'm sure a lot of stuff you guys would know already. I just wanted to get through the basics of dosage forms. For our next episode, we're going to be dealing with the differences between trade names and generic names. If you guys know the differences, please write the answers in the comment section below. Thank you guys for watching. I will be trying to release a video once a week, and thanks again for your support, and take care and enjoy. Bye.